This year's Board of Healthcare Funders Conference is looking at a myriad of issues that affect the healthcare sector. A key concern raised requiring action and prevention is the growing burden of disease.
We've always spoken about the quadruple burden of disease. But in the last few years, maybe decade or so, we've seen what we call the non-communicable diseases. This includes your cancers, diabetes, heart disease, etc., starting to accelerate to the point where they are overtaking the communicable diseases. We've had a scourge of ailments like HIV, malaria, and TB. They are still the top killers, but your diabetes and cancers, hypertensions are actually fast approaching, and we need to have a handle on those.
As mentioned, cancer continues to grow exponentially the world over, and discussions were had around innovation in the scanning and treatment of the varying manifestations of this disease. Experts say education is critical to ensure people's awareness not just of cancer but other chronic diseases, with the Phakamisa initiative here in South Africa being used to achieve this goal.
So Phakamisa is, my understanding in the African language is uplifting. And that is what we aim to do, right? To uplift the community across the different non-communicable diseases. So cancer is one of them. And what we want to do is to work with the community to first and foremost raise the awareness, the importance of cancer, and the importance of how treatable cancers can be if they are screened and detected early. We can have the best medicines in the world, but if we pick them up too late, then the outcomes will be less than ideal.
Innovative ways of diagnosing cancer, particularly for households that struggle with healthcare access, were also discussed.
What we need to do is to see how we can impact the entire patient journey and find innovative solutions as part of the process. So this morning when we were at the conference, we had the opportunity to have Dr. Catherine, which is the founder and CEO of a South African company called MedSol AI. And what their company focuses on is to use a handheld, small ultrasound machine that they can train operators within, a weekend and be able to take this to remote villages, remote centers within South Africa and the rest of the African continent to help diagnose breast cancer. So that is a very smart way of using technology to overcome some of these resource limitations that we have.
The conference tried to unpack the implications of the National Health Insurance Bill, which President Cyril Ramaphosa is still yet to sign into law. The Board of Healthcare Funders says it has made approaches to the presidency to engage further on the bill, as the private healthcare sector still has many questions around how the National Insurance Fund will work, and more importantly, to what extent medical aid schemes will be excluded from participating in the healthcare sector, given the grave implications this could have for their sustainability.
That concerns us. One, because at the moment, there's about 9 million beneficiaries that find healthcare services through the medical aid schemes. The immediate challenge would be you've got 9 million people more that would have to depend on the state for healthcare services.
Dr. Matudi says the government has remained unclear as to how it will fund the NHI, which is set to cost hundreds of billions of rand per year, adding that resorting to taxing the currently wafer-thin South African tax base doesn't look practicable. Nompumelelo Siziba, SABC News, Johannesburg.